The work week is winding right on down. We've got some guests with us today, some good guests. We'll be talking with West Alabama AIDS Outreach.
NorthStar EMS is here today too, and we'll be talking with Para about the most wonderful time of the year, Christmas.
Yeah. Do you know what to do in the case of an emergency? We'll be talking with NorthStar EMS.
Do you know what to do in an emergency? If you said call 911, that's right. But how quickly you can communicate vital information to the operator could mean the difference between life and death. Brent Durkeen and Portia McBride are here from NorthStar EMS to tell us more. Thanks for being with us.
Thank you, Claire.
Thank you.
Great. Well, let's start off by talking about EMS. WVUA and EMS are now partnering up. So tell us a little bit about this partnership.
Well, in the recent month, NorthStar EMS was fortunate enough to be selected by the city of Tuscaloosa to serve as the city's sole ambulance provider. So as part of our commitment in that process, we have committed to working with our media partners to provide information to help our citizens understand a little bit more about injury and illness prevention strategies, and certainly to educate them as much as we can on EMS and how to access it if indeed they need an ambulance to arrive to provide medical care and transportation services.
Now, Portia, you are one of the dispatchers. So when people call 911, do they hear from you, or do that call comes to you, correct?
Well, it depends on exactly what they need. A lot of times the call is directed to the fire department first, and they go based off if it's a medical necessity or if there's a need for fire or law enforcement. And if it's a health situation, then they connect us.
Okay. Now tell us, what's the most important thing our viewers need to get to you? What information do they need to get to you to make it to make a difference?
Well, when you call 911, it's very important that we know the location of the patient. Exactly where the patient is, not necessarily where they're calling from, because a lot of people call from different locations. If they hear about it, we get second party, third party calls. So we need to know exactly where the patient is. A great callback number, one that works just in case we're disconnected for any reason, so we can get the caller back on the line to find out what's going on. The chief complaint, which is exactly what's going on with the patient, what is the reason for the call. The age of the patient is very important. And also, if there are multiple patients, we need to know that so we can help. And also, just the medical history.
How quickly can an ambulance get out onto a scene once they receive the call?
Claire, NorthStar has pre-positioned resources throughout the community, so we have many ambulances on duty at varying hours of the day. And our goal, based upon the new strategies that we've been working on, is for an emergency to try to be there within 9 minutes or less, 90% of the time. So that's an aggressive strategy, and we work very hard to accomplish that goal on a daily basis.
Wonderful. Well, we appreciate you being with us today. Thank you so much.
All right, thank you very much.
Well, if you're in an emergency situation and you can get to pick up a phone, dial 911. You can find more information about NorthStar EMS online at northstar-ems.us.